Okay, so I think in a second you're going to lose my face, but you should be able to hear me still. So we should be good there. Okay, so I did my presentation on Dival Pro X, which also has the name Depakote, and it is originally used for, it was created for seizures, to help with bipolar, mood stabilization, especially the manic phase. And I am especially interested in it for its potential for mood stability with personality disorders. So the history is it was approved in 1983 by the FDA to assist with epilepsy, so seizures, as I mentioned. Um, and that's common with many mood stabilizers. They also are anticonvulsants a lot of the time. The drug began, there you go, as an anticonvulsant before its use in treating personality disorders and bipolar. Um, the drug is synthesized in the body as valproic acid, and that valproic acid dates back to 1882. So it's kind of similar to the idea of we have cortisol in our bodies, but the medication that we would take is called hydrocortisone. Um, and so it's two different names, but really it's just one is synthesized outside of the body and the other is what we call it when it's inside of the body. So same kind of idea there. Inside the body, it's valproic acid, and we just call it something else, Divalproex or Depakote or whatever you want to call it when it's in a medication form outside of the body. Okay, and it's used to treat migraine headaches, seizures, and borderline personality disorder. So how it works, it increases the GABA in the brain. So the GABA acts as the brakes, right? So when there's more GABA, the brain has an easier time slowing down anxiety, those kind of stress responses. And when there's not GABA present on the flip side, the brain continues to send those stress signals even after the threats pass because it doesn't have the ability to hit the brakes, essentially. So more GABA is kind of like that negative feedback loop. So you can think of, for a negative feedback loop, think of your air conditioner in your home, right? Once, if you are trying to get it cooled down and you have it set to 72 degrees and it's currently 75, once it hits 71 degrees or 72, it's going to shut off, right? Once it reaches its goal, it shuts off. So in your brain, if you have more GABA, once you pass whatever threat level you're going through, it's that negative feedback loop. So it should increase the GABA and stop that stress response. If you have less GABA, it's more like a positive feedback loop. So think of how your body makes scabs, which is kind of gross, but your body makes scabs by it's this positive feedback loop. So when it gets an indication that it needs to make a scab because you have a cut on your arm or your leg or something, it will actually continue to make and make and make and make because that's how it's designed, that's how it's meant to work. Um, uh, the birth process of having a baby actually works that same way with a positive feedback loop. So if we have less GABA, that's going to be what it resembles a little bit more, which we don't want when it comes to a stress response. So the half-life, most common variant is Dival X delayed release. So that has a half-life. It works for about 9 to 16 hours, and some places actually say up to 18 hours. And it has a coating that allows it to slowly release. So the goal is that you don't chew it. When you take it, you want to swallow it so that that coating stays intact. The option for immediate release is valproic acid, which we already talked about. And it has a much shorter half-life, 4 to 16 hours. So I'm guessing it's closer to around that 4-hour mark. And it's immediate release because it doesn't have that coating, but it is more tied to gastrointestinal concerns. So some of the side effects, the common ones that we hear about for pretty much every drug would be nausea, headache, drowsiness, a tremor, possibly muscle weakness, insomnia, hair loss, weight gain, diarrhea. Some of the rare and serious ones are any problems with the liver. It's actually metabolized in the liver, so that's what some of those problems would lead to. Low platelets. So if you really easily bruise, those platelets are going to be involved. That's kind of like the blood's ability to clot. And so kind of what I talked about with the scabbing actually. If you have low platelets, your blood isn't easily able to clot together, and so you would bruise pretty easily. Pancreatitis is a pretty serious one, as well as increased ammonia levels, which can lead to confusion and difficulty concentrating. And if that one is left untreated, it can be more long term. Contraindications. So these are the things that you would not want to be taking this medication if you also experienced these things. So high amount of ammonium in the blood, which we talked about, that can lead to that confusion. Low amount of albumin proteins in the blood. I looked this up. This is also related to the platelets and clotting. Hereditary liver, again, that's where it's metabolized. So if you have problems with your liver, this is probably not going to be the right drug for you. Decreased blood platelets, kind of same idea there. Suicidal thoughts and depression. This drug is more meant to treat those manic symptoms, and so depressive or suicidal ones, they wouldn't be a great thing to have going on at the same time. And then you have this list over here: liver problems, inflammation of the pancreas, so pancreatitis, which can be one of the symptoms, or the side effects rather. If you're pregnant, you shouldn't be taking it. Urea cycle disorder, yeah. So first case example. So I just wrote a vignette. Due to John's desire to specifically, I skipped one there. John is in his mid-30s and has battled through seasons of life where he doesn't want to get out of bed, and other seasons where he'll make rash decisions such as buying a new TV or a car without a second thought. He reports no history of suicidal thoughts, which is good, but has recently received a diagnosis from a counselor as bipolar disorder, and he's requesting medicine to specifically address his manic phases because these episodes are more troubling because he has more ramifications of his actions that he takes during these times. So this would be a good candidate for possibly Divalproex or Depakote. His desire to target his manic stages, that's a pretty good fit. He doesn't experience suicidal thoughts, which is a major contraindication. So I would start John with 250 milligrams of a delayed release Divalproex twice daily and move up depending on his own reports and those of others close to him. Let's look at the next one. So Jen is a mid-20s female who's struggling in her relationships. In her early teens, she struggled to make friends because she was often called too emotional. She can become very upset when she's angry and say things she doesn't mean. In her romantic relationships, this often turns to threats of self-harm if her partner does something she doesn't like. She'll ask for them to be close to her, but in a moment's notice can turn and say they are the worst person in the world. She recognizes this as an issue and wonders if there are medications to help her feel more stable. So this would be probably a case of borderline personality disorder. Her hot and cold tendencies, as well as threats of physical harm, indicate unstable view of others and herself, expectations that others can't really meet. Her moments of lashing out could fall in line with behaviors of bipolar disorder, manic phases, and that's kind of where we look for that overlap between borderline and bipolar when we want to use something like Divalproex, because it's specifically targeted at that GABA manic phase behavior. So increasing the GABA again, decreasing those manic behaviors. So that might help slow the brain down when Jen starts to kind of feel like she's spiraling, right? So I would, again, start Jen with a small dose of 250 milligrams, delayed release twice daily, and increase if it's needed. There's my bibliography, and that is Divalproex and Depakote. Thank you.